our vaccination model is targeted to forecast at what time, given certain parameters like the effectiveness of vaccine, like the willingness to be vaccinated of the general population, and how fast can the vaccine be deployed, like health workers, urban people, and rural people, and different age group, they have different priorities. So after considering all these constraints, we simulate how the population will be vaccinated and how fast can the herd immunity be achieved. And then we summarize at what time the world is okay to reopen, or each country is okay to reopen to normal life, and business travel and transportation of goods and people can be resumed.
Why do you think your model is more effective than the models being used in Europe and the US?
Well, actually, I cannot say that it's more effective. It's more realistic. Basically, we take into different parameters, like what I mentioned, the manufacturing capacity, the efficiency of the government, how they apply these vaccines, and how many people are willing to take the vaccines, and also, what is the effectiveness? Like we have seen the numbers of effectiveness of the vaccines range between the 60% to 95%. So our model is very flexible.
How important is the vaccination rate to your forecast?
It is one of the most important parameters in our model. So vaccination rate, what we mean is how efficient can the government and health workers can deliver or vaccinate people. According to Pfizer and Moderna, and also some other manufacturers, including China's Sinopharm and Sinovac, the effectiveness is around 80% to 90%, which is pretty high. And also we found that the willingness to be vaccinated is also high, at least in some of the European countries. In the United States, the willingness to take the vaccine is relatively low, because if you have less than 50% of the population willing to be vaccinated, you have to wait until, probably 20% of the population to be infected to get into a certain level, for example, 70% of herd immunity. So that will take some time.
Have you any data as yet as to the effectiveness of each vaccine?
There's the numbers that ranges from 60% to 95%. And the number could be different for different age group. We have a different trial experiment in different countries. For example, there's a new vaccine coming out from Johnson & Johnson, and the overall vaccine effectiveness is 66%. In US is 72%. In South Africa, whereas the new variant of the virus, it's 57%. In Latin America, it's 66%. So you can see that there is some range of the reported effectiveness of this vaccine, but overall the vaccine effectiveness level is relatively high compared to other vaccines like the general flu vaccine. And so the effectiveness of the current form of this virus is not a big concern right now. The bigger concern is how are people willing to be vaccinated and how fast the government can deploy this vaccine.
Okay, we've got two runners in this race. We've got the virus and we've got the vaccination program. One pulls ahead of the other sometimes, but who's going to win that race?
Well, right now, basically, even with some variant of this virus in different countries, like in South Africa, the vaccine still shows relatively high effectiveness, but we are definitely worried. But I believe with the help of the researchers in vaccines, with the public health professionals, and with effective administration of the vaccine, I think definitely we are going to win this war against this pandemic.
Well, we all support you in that. So, Chen Jian, many thanks to you for joining us on The Agenda.
Thank you, Steve. My pleasure.